So, welcome everyone to my channel, which is Pharma Coach. And in today's Pharma Coach class, I'll be telling you about this syrup. So, syrups are the sweet, concentrated aqueous solution of a sugar with or without flavoring and medicinal substances. So, सिरप्स जो हैं वो कंसनट्रेटेड एक्वस सोल्यूशन होती हैं जिसमें विद और विदाउट फ्लेविन एंड मेडिसिनल सब्सटेंसेस होते हैं. So, sugars mostly contain the sugar, but sometimes instead of sugar, the sugar substitute is to be added, especially for diabetic patients. And these are said to be sugar-free syrups. So, mostly syrup में sugar use होता है, लेकिन sometimes, like in case of diabetic patient, इसमें sugar substitute भी use होता है. So mostly the concentration of sugar is usually 85% to 66.7%. So at this concentration, the growth of microorganisms is prevented, especially yeast and mold. So if the syrup is used early, then no need of an additional preservative. But if the syrup is required to be stored, then preservatives are to be added. तो कंसनट्रेशन शुगर की 85% या 66.7% है. क्यों? क्योंकि इस कंसनट्रेशन पे माइक्रोबियल ग्रोथ प्रिवेंट हो जाती है. तो इफ यू वांट स्टोर द सिरप फॉर लॉन्गर पीरियड ऑफ टाइम देन preservative are also supposed to be added. Now the types of syrup. So we have the simple syrup and medicated syrup. So what is simple syrup? So when purified water is used only to make the solution of sugar is known as simple sugar. For example, if we are having 85 grams of sucrose and 100 ml of water, so it is the example of simple syrup. Now the medicated syrup. So when the aqueous preparation contains the medicinal substances, it is called the medicated syrup. So number 3, we have the flavored syrup. So it is the type of syrup that only contains the flavoring agent but no any medicinal agent. They're used to mask the bitter taste of drug. So flavored syrup bitter taste को mask करने के लिए use होती हैं और इनमें just flavoring agent होता है लेकिन medicinal agent नहीं होता. How the components of sugar. So many sugars contain the following components along with purified water that include sugar, antimicrobial agent, flavorants and coloring agent. So component of sugar में हमारे पास sugar, antimicrobial agent, flavorants और colorants होते हैं. So number 1 we have the sugar. So sucrose is the sugar most frequently used in the preparation of syrup. But in some condition it may be replaced whole or to some extent with non-sugar substances such as sorbitol, glycerin and propylene glycol. For diabetic patients, all the glycogenic parts of syrup is replaced with non-glycogenic substances. So syrup में sucrose as a sugar mostly use होता है. But in diabetic patient, it is replaced with some non-sugar substances as well. Like हमारे पास sorbitol, glycerin और propylene glycol है. What is difference between the glycogenic substances and non-glycogenic substances? So glycogenic substances means agent that converted into sugar in the body, whereas non-glycogenic substances means they don't convert into sugar in the body. Why? Because they are not metabolized and not absorbed into the bloodstream. Example, we have methyl cellulose, hydroxyethyl cellulose, and they are to be used just because to produce the desired viscosity. So glycogenic substances sugar provide करते हैं means as a sweetening agent use होते हैं, whereas non-glycogenic substances just these are used to provide the viscosity. Again, flavoring and sweetening agent are used to mask the bitter taste and unpleasant odor of the drug. So viscosity of syrup for diabetic patient is maintained by the use of these cellulose derivatives. Now what is antimicrobial agent? So it is the amount of preservative required to protect a drug against microbe varies with the proportion of water available for growth capability of preservative. Most commonly used preservatives are benzoic acid, sodium benzoate, methyl paraben and butyl paraben. So now the flavorants. So what is flavorant? Flavorants are used to provide the flavor and they may be synthetic or natural one. So the synthetic, we have the example like volatile oils, vanillin and etc. Because the syrups are aqueous preparations, so therefore these flavorants must be water soluble. Means flavorants must be water soluble. Now the coloring agent. So these are used to provide the color, and the purpose of providing color is to increase the elegancy. So example, we have like green color with mint, brown with chocolate. And coloring agent should be water soluble, non-reactive with other syrup components, and color should be a must stable at pH range. Now the preparation of the syrup. So we have the four methods to produce the syrup, but selection of method is depend upon the physical and chemical characteristic of ingredients. So number one, we have solution with aid of heat. This method is used for heat stable substances, or when we require like we want to make the syrup in no time. तो इसका मेथड कुछ यूं है कि शुगर को प्योरीफाइड वाटर में ऐड करेंगे और फिर उसको हीट करेंगे, एंड देन द हीट स्टेबल कंपोनेंट्स आर एडेड. After that, mixture is allowed to cool, and finally the volume is adjusted with the help of water. And method 2, we have the solution by agitation without heat. So this method is used for thermolabile substances. Syrup prepared by this method has maximum stability, but this is time consuming process. So the method we have like number 1, sucrose and all the agents are maybe dissolved in purified water in a vessel and then thoroughly agitate the mixture. And number 2, we have like addition of sucrose to a medicated liquid. मेथड में पहले हमें medicated liquid बनाना पड़ेगा, फिर उसमें we have to add the sucrose. And number 4, we have the percolation method. So it is the extraction technique. For this, percolator is used in this water is allowed to pass through a bed of crystalline sucrose. Finally, as a product extract syrup is formed. So ये एक एक्सट्रैक्शन टेक्निक है और इसमें परकुलेटर भी यूज होता है. इसमें वाटर इज अलाउड टू पास थ्रू द बेड ऑफ क्रिस्टलाइन सक्रोज. वाटर पास करते हैं बेड ऑफ क्रिस्टलाइन सक्रोज से, एज अ रिजल्ट syrup is formed. So that was all about today's lecture, and if you like my videos, do like and subscribe my channel, which is Pharmacodes, and thanks for watching my video.